Hey guys, welcome back to the channel. If you're new here, my name is Ali. I'm a junior doctor working in Cambridge, and in this video I'm talking to another fellow junior doctor who is 1 year senior to me. His name is Mohammed and he goes by That Medic on YouTube. He makes videos about life as a doctor as well. And we had a conversation that lasted about 15 minutes about tips for how to be a good junior doctor, how to be a good F1, which means the first year of being a doctor. So I was asking him some questions and he was giving me some really useful advice, combined with sharing some of our experiences about what life on the job has been like so far. So yeah, if you want, you can catch this whole episode in audio format on the podcast at intercourse.fm. Link will be in the description below. And I'll leave links to Mohammed's YouTube channel and his Instagram so you can check those out. But without further ado, here is the conversation between me and Mohammed, i.e. That Medic, which is a very brandable name. Like, I get a bit annoyed every time I have to spell out my YouTube channel's name, because there's no easy way of Ali Abdaal. Never mind. Here is the conversation. So hey, Mohammed, welcome to the podcast, welcome to the channel, depending on where people are watching this.
Thank you very much. Thanks for having me.
No, thank you for coming on. Can you just give us a quick intro to who you are and what you do?
So my name is Mohammed. I am a doctor. I'm working in London at the moment. I'm a second year foundation doctor. So I've had a year and a bit experience, and I also make films on YouTube, medicine, travel, lifestyle, the whole lot, with a bit of hip hop.
Yeah, so I actually discovered your channel sort of back when I was first starting YouTube, and the editing on your videos was just absolutely extraordinary.
Oh, thank you.
If you guys haven't seen Mohammed's videos, he's That Medic on YouTube. I'll link all the stuff in the show notes and in the video description. But somehow you managed to film tons and tons of footage of all your 5 years of medical school, and then you edited them all to make highlight reels for each year. So that was just pretty awesome. But in this little podcast episode, in this video, we're going to talk about you giving me advice on how to be a good doctor.
Absolutely.
Because I'm in my first year of being a junior doctor, you're in your second, so you've done kind of the first year, you've kind of been through it. So let's just jump into it. What are your top tips for being a junior doctor, being an F1?
Okay, so my top tip for being an F1, hands down, is to be vigilant and to learn from your mistakes. That's the only thing that's going to help you through your time as a doctor. Okay,
well, can you elaborate? Surely everyone would do that by default, or have you seen cases where that's not really happened?
So it's actually quite difficult to, because you're kind of running through your time as a doctor from the first person, it's very difficult to see what you're doing and whether you're doing it right. And a lot of the times you just sort of do what's instinctively right. And it's difficult to see that from a third perspective. And it's sometimes important to look at it from a third perspective and to be vigilant and see, actually, is this the best way to do it? Is this the best kind of way I could have gone about certain situations?
Okay, so would you kind of analyze your own actions, or would you ask someone else to sort of give you feedback? How does that work in practice?
Exactly. So as a junior doctor, as an F1, you are the most inexperienced doctor in the hospital. So everyone is more experienced than you and everyone can give you advice. So that's from nurses who have spent more time in clinics, and that's from doctors and whoever, whichever healthcare professional is around you. So it's very important that you seek feedback, and the foundation program at the moment encourages you to do that by, reflecting on different cases and having case-based discussions and asking people to evaluate how you are as a doctor, as a professional. And it's very important that you do seek feedback, either actively or through this foundation program.
Okay, because it's interesting you say that. That was something I was thinking about yesterday while I was at work, because there was half an hour of downtime, and in that time I was kind of thinking it would be nice if I could ask kind of the registrar or the CT2 or whatever to just give me tips on what I could be doing differently. And I guess people are generally reluctant to criticize, but I suppose if from my perspective, if I was kind of actively being open to it, so look, I want to be a better doctor, what would you, what sort of tips have you got? What should I be doing differently? I suppose they'd probably appreciate that.
Absolutely. And I think British people, just as a kind of just a natural kind of personality trait, we're very bad at giving people compliments. We're very bad at receiving compliments, and we're also bad at criticizing people and then also receiving criticism. So in terms of feedback, we're just really bad at it entirely.
Right.
So I think it just comes down to the fact that if you are open to that idea and you ask for it and you seek it, and you also have to kind of seek it from the right person as well. There might be a registrar that you kind of have a better relationship with, who you can ask more kind of open questions to, and they would also feel comfortable giving you quite frank feedback. Okay. So it's also about who you kind of seek advice from.
Got it. That makes sense. So point number one, get feedback, solicit feedback, and actively work on it. So you're an F2, so presumably you now have F1s kind of sort of underneath you. So what makes a good F1, and what's the ideal F1 that you'd like to have as your minion?
So I think with a lot of medicine, you're faced with a problem. and then you have to find a solution to it. So it could either be a medical condition, and then you have to find the treatment or the right investigations to go about it. A lot of the questions that F1s usually have, they can find the own answer to by doing a bit of research, opening a book, or kind of going on some trusted internet websites to find out which investigation is best suited. But sometimes the easier option is just to ask. So depending on the situation, a good F1 would sort of seek advice, but also suggest a solution.
Okay.
And I think that's the best way to learn.
Okay, yeah, that sort of makes sense, because I can remember these past few weeks, I've had so many questions where I've been thinking of sending a WhatsApp message to our registrar and asking what the answer is. But then I kind of think that, okay, well, maybe they're busy, maybe they won't reply. So then I find the answer myself, or give a suggestion, and then I kind of WhatsApp being like, okay, I think we should be giving 1.2 grams of comoxiclav. Is that legit? And then Absolutely. At some point they'll reply with a yes. And I think it's a lot easier for them rather than giving me instructions.
And also you learn.
Yeah.
So I'll give an example which was quite memorable to me. So we had a patient who had kind of an episode of leg shaking overnight. The easy thing to do would to say, call the registrar or my SHO and say, look, my patient's doing this, what should I do? So that's probably what's sort of expected of you in that situation. You've noticed something that's abnormal, and then you've escalated up. But I think a good F1 would kind of go to the patient, take a history, do an examination, think about what possibly could be going on here, come up with a list of differentials. And then when you speak to your registrar, you've got a possible kind of differential and you've got more information about what's going on. If you want to take it a step further, you can say, look, I think it's this, and this is what I think we should do. What do you think? And I think that's probably the limit of where an F1 should be going to. And as you get more confident and you become an SHO, which is a senior house officer, which is your second year on, you can start initiating certain management on your own.
Okay. So point number one, solicit feedback, act on it. And point number two, kind of, in a way, take the initiative when you're asking for stuff. Offer a default option, and then they can correct you if you're wrong.
Absolutely.
Rather than just asking the question. Asking the question. Okay. Have you made any kind of, like, if you want my talking, any sort of big mistakes during your time as an F1, and how did you deal with them?
Absolutely. I think we've all made mistakes, and I'm quite happy to talk about them. So the mistakes that I've personally made have come when I've been rushed, when I haven't really thought something through. So it's always a situation where I'm on call, I'm late for handover, the nurses are really kind of, they're asking something of me, I don't have enough time to do it. So then if I do a half-hearted job, that's when you make mistakes. And they often get picked up by other people, so the nurse is administering it, or the patient themselves, or that sort of thing. So one of the things I made was dosing Warfarin. So we had a patient on the surgical ward who was in with jaundice, which is essentially the yellowing of your skin due to kind of liver dysfunction. At that point, I was trying to dose her Warfarin, and I just prescribed her usual Warfarin dose, which for 80% of kind of people, that would be okay. But if I'd been more vigilant, I would have thought, and if I had more time, I would have thought to look at the liver function and the rest of her blood results and her investigations. And then maybe I would have picked up the fact that actually her liver function wasn't doing too well. So if I gave her usual Warfarin dose, her INR, so how easy she is to bleed, would be super high, and that would be dangerous. So luckily that was picked up by my SHO, who sort of took me to the side and said, when you're dosing Warfarin, it's a simple F1 task, but in certain cases, you need to kind of think about other things, maybe look at liver function, etc.
Oh, okay. Yeah, so like there was a mistake I made fairly early on as well, which, as you said, was down to being rushed and not really knowing what was going on. So this was kind of a medication error where I discharged a patient on 3 different kind of blood thinning medications, which they were on in hospital, but I didn't realize there was a note saying that one of them should be stopped. Then, because there were so many patients on the ward that day and the pharmacist didn't get around to checking the drugs, I put them on as like self-check to help the patient go home better, because I didn't really know what that meant, and the nurses were asking for it. So all these different things lined up to the point where this wasn't picked up. And then when it was found out, then the registrar took me aside and he kind of explained that, this is what happened. Partly, it's a fault of the system that, all these checks were in place, but, the circumstances meant that they just didn't happen on the day. So I suppose, like, have you got any tips for avoid, like, if you are, you've got loads of patients, you don't have much time, how do you avoid making these sorts of mistakes?
So my advice would probably not be reciprocated by the bed managers who are in charge of how the beds work, but your job as a doctor isn't to manage the beds, isn't to get this patient out of hospital. It's to ensure the safety of the patient and to ensure that they receive the medical care that they rightfully need. So if by trying to discharge a patient on the same day that sort of compromises their care or their safety, then I would say to avoid it. And from the patient side of things, it's not the most comfortable thing to stay another night in hospital, but I'm sure they'd rather that than be on the wrong medications. And that would really annoy the bed managers if they heard me say that, but being rushed, you make errors. And they've done several audits and several amounts of research, and it always shows that people make mistakes when they're rushed and when they're being pressured to do things.
Okay, so I suppose we're saying that it's not really our job, as it were, to worry about what the bed situation is.
Absolutely.
Our job is to we are in charge of the care of the person at hand. And yeah, there's lots of other pressures, but you know what? The patient's safety is my number one priority.
Absolutely.
Everything else comes secondary to that, whether it's the bed crisis or anything else.
Absolutely.
Okay. Have you got any tips for how to be friendly with nurses and how to deal with that side of the doctor-nurse relationship?
Okay, so first rule:
Yeah.
nurses run hospitals. Doctors just work in a hospital. Nurses run the hospital. Nurses are the ones that spend every single minute of the day with the patients, and they know them very well. So the nurses are very important in your role as a doctor. And it all comes down to the fact that everyone has their roles and everyone should know what their role is. But just because the nurses are in charge of the kind of day-to-day care, it comes and they do take on a lot of responsibility in ensuring certain tasks are done. And a lot of the kind of doctor's role is trying to get those tasks to be done by the nurses. But I guess it comes down to how you approach that situation. So the way I sort of kind of pose it is I always like to kind of give the nurses an update about what's going on and our rationale behind doing certain tasks.
Okay.
And in doing so, you involve them in the conversation about what's going on with the care of the patient. And they always do kind of sometimes give you a bit of feedback, sometimes say, oh, that's actually a good idea, or maybe we should do this and this. And then it's entirely up to you whether you listen to that or not. But I think involving them in sort of the conversation, giving them updates about what's going on, and then posing the task as sort of kind of like a management planning, making them an integral part of it, is the best way to approach it.
Oh, okay, that's interesting. Because at the moment on our ward rounds, for the most part, we see the patient, we write it into the notes on the computer system, and then we go on to the next patient. But you're saying there is maybe something to be said for, when I've got a bit of time because the consultant's gone away to clinic or whatever, just going up to the nurses and being like, okay, right, here's an update. This is what we're doing about Mr. So-and-so.
Absolutely, that's exactly what I do. So the consultant comes in, sees all the patients and then rushes off to clinic, and then after that I then do another handover to the nurses looking after the patient, and also sometimes to the head sister.
Oh, okay.
So I feel that's the best way to do it.
Okay, that makes sense.
And then it's also about the little things. It's like being married. So I have a lot of experience. I don't have any experience in being married, but it's also about the little things. So things like, can we get a bladder scan? You can grab the bladder scanner and it's like a gun. You kind of press a lever and then you get that.
Oh, I've literally never done a bladder scan.
It's really easy.
Oh,
It's honestly super easy.
Yeah.
And you just need to pick up the bladder scanner and do it yourself. And those little things nurses do notice. Or when you kind of do a cannula or whatever and use that silver tray, kind of wiping it down and then putting it to the side kind of saves them another job. And they notice these little things, and then that does eventually get them on your side.
Oh, sick. Thanks. I'll keep that in mind.
And also compliment them.
Compliment them. Okay, cool. Yeah, because you said we British are bad at giving compliments.
Yes, absolutely. And just in general, you want to get to know the team that you're going to be spending a lot of time with. So try to get to know their story, try to get to know their interests. So like we've got a running joke with the nurses at the moment who love Friends. I know I love Friends. Yeah. So I greet the nurses every day by saying, how you doing? So it's just about those little things, having a little bit of banter and just kind of be friends, really.
All right, awesome. So we've talked about actively soliciting feedback, taking advice from it. We've talked about dealing with nurses and just being friendly in general. We've talked about how to avoid making mistakes. One last thing, from next week, I've got my first crop of night shifts for like 5 days in a row. Have you got any tips for dealing with nights?
Yes. So first step, get yourself a set of blackout curtains.
Oh, I've got blackout curtains.
You've got blackout curtains. Very, very important.
Yeah.
So that's the first thing I did. The next thing is you need to shift your sort of kind of sleep cycle. How good are you at sleeping?
It varies. I tend to read a lot before going to bed, and then I feel tired.
So I would spend sort of after work, just stay up the entire night, and then that way you're so tired that you sleep the entire time through the day. And then that way you've kind of readjusted to night shift work.
Oh, as in on the first day, on the day before, just stay up that night?
Exactly.
Oh, that's fine. I can just do some editing.
You can
that
do
night.
that, exactly.
Yeah,
and then the other thing is that as you go through your night shift, the first thing you'll do is you'll go to handover, and then you'll get a list of jobs to do. The first thing you do is you prioritize them. So you get the patient reviews out of the way first for the sick patients. Then you do the time critical medications and the other things, x-rays, CTPAs, and all the other scans that you need to chase. And then you can do things like rewriting a drug chart or something for 6 a.m. or kind of preparing a TTA or whatever else you have to do. So the thing that a lot of people kind of struggle with is at night is that because you're out of hours, there are less doctors around. But also as the night on-call doctor, your only responsibility really is to do the critical stuff. So only review the patients that need really to be reviewed. So I remember getting called about a sodium that was always 113 or 114, which is really low, dangerously low if it was an acute episode, but it was like that forever. And the nurse called me in the middle of the night, was like, his sodium's 113. I was literally like, oh my God, like what's his blood pressure? Trying to find out if this patient was all right. Then I logged onto a computer and found out it'd always been like that for 3 years. So it's that sort of thing that kind of with experience, you build up a sense of this job doesn't really need to be done now. And by doing that, you can then filter out all of the crap and just do the things that really need to be done overnight. And I think the best thing to do is to actually go through your list with an SHO or someone with more experience than you and sort of go through it and be like, actually, in your opinion, which ones do you think I need to do first? And you might already know, but it's actually kind of worth just getting that sort of secondary feedback or a kind of second pair of eyes to look at your list. And in your head, you could be like, oh yeah, I agree. Oh, actually, I didn't realize that was so important. And then you'll find out.
Okay. Brilliant. That makes sense. I will keep those in mind when starting the shift for the first time, and I'll send you a text if I
absolutely
have any issues.
If you need me, hit me up.
All right. Well, thank you very much for coming on the channel.
Thank you.
It's been a pleasure. And we've done a video on your channel where we're talking about like comparing King's College London, or rather GKT, the med school at King's versus Cambridge. So you guys might like to check that out if you want.
Absolutely.
All right. So thanks, and I'll see you later.
Thank you very much.
All right. So that was the conversation. Thank you very much for watching / listening. I hope you gained something from that. I know I certainly did, and I got lots of actionable tips that I'm taking forward actively now in the remaining time that I've got as an FY1 junior doctor. So thanks for watching. If you liked the video, please give it a thumbs up. If you haven't subscribed to the channel, please consider doing so, and have a look at Mohammed's channel as well, where we've done a video comparing Cambridge and King's as far as medical schools go, so you can watch that if that floats your boat. But otherwise, yeah, thanks. I'll see you in the next video. Bye-bye.